In this video, we show how we perform a talonavicular joint arthrodesis with the shark screw allograft. The patient is a 72-year-old female. Due to degeneration of the right talonavicular joint, arthrodesis is performed with 3 shark screw allografts. We make a straight dorsal skin incision over the talonavicular joint. Taking care not to damage the neurovascular bundle, we approach the tendon of the tibialis anterior muscle laterally. We expose the talonavicular joint with Hohmann retractors and elevate the joint capsule and periosteum. After spreading the joint, we remove the remaining cartilage with a slightly bent chisel and the Lear ronger. The partially sclerotic bone is freshened with a thin 1.5 mm drill. The shavings remain in place. We now place the joint surfaces of the talus and the navicular bone under maximum compression. At the same time, we set 3 1.6 K wires from distal to proximal. We use 1.6 mm wires to prevent bending of the wires during insertion. This creates a very secure connection, ensuring safe positioning of the bones during drilling and threading. Beginning with the middle K wire, we now replace the 1.6 K wires with 1.2 mm wires, over which we drill using the thinnest blue drill in the first place. In this case, we aim to use the 5 mm shark screw allograft. So that the bone does not heat up, we enlarge step by step up to the 5 mm drill and slowly thread with the 5 mm threader. The depth of the drill and the thread cutter is shown on the laser markings. Finally, we have to rinse the female thread with saline solution, as even small shavings would prevent insertion of the shark screw. After screwing in, we cut off the protruding screw material with an oscillating saw at bone level. The allograft resides within the bone and does not rise above its surface. The shark screw ensures an absolutely rotationally stable arthrodesis that is under compression. In postoperative X-rays, the shark screw allografts are clearly visible. By the physiological bone metabolism, the bone screw is completely integrated and remodeled. After the operation, a lower leg split cast is applied for 1 week, followed by a closed lower leg cast for 5 weeks. Non-weight bearing is indicated for the first 3 weeks after surgery. The cast is removed after 6 weeks and replaced by a surgical shoe to be worn for another 6 weeks.